Vasectomy is a highly effective form of contraception, very reliable. Men are often concerned that it's going to affect their sex life, though, which it doesn't. In fact, quite the opposite. Many men say that their sex life improves after a vasectomy because they're no longer worried about unintended pregnancy. Does it affect your virility, your erection, your ejaculation, orgasm? No. It's because all it's doing is stopping sperm from getting into your semen. So you still get an erection as normal, you still ejaculate as normal, sex drive as normal, everything is normal. The only thing that changes is that over the few months after a vasectomy, there's less and less sperm that get into your semen. Vasectomy is highly effective and reliable as a form of contraception, but for the first 3 months after you've had a vasectomy, you will still potentially be able to impregnate your partner. So we recommend that you ejaculate frequently, regularly, 3 or 4 times a week if you can. And then over the period of that time, the sperm that are left in the system will get flushed out. And then at 3 months, usually most men are clear. Managing expectations after a vasectomy is really important because normally when you have a surgical procedure, it's because you have a problem and you want to fix it. Whereas with a vasectomy, you don't have a problem and then you have a sore scrotum, which needs to be managed because if you do too much too quickly, you can actually delay your recovery. So it's important that you take things slowly and go back to work gradually and certainly sport quite gradually. So you can't play contact sports or ride a bike for about 3 weeks after a vasectomy. Men can become sexually active after a vasectomy about 5 days post procedure. Most men start with masturbation just to reassure themselves that everything's working normally, and it will be working normally. And then, if that feels okay, then you can move on to something more interesting. But you can become erect and ejaculate in exactly the same way as normal. You might just get a little bit of blood in your semen, so don't be alarmed by that. Your scrotum will feel a bit sore and bruised initially, but everything will be working normally.